This medication is a hormone called estrogen. It is used by women to help reduce symptoms of menopause, such as hot flashes and vaginal dryness. These symptoms occur because the body produces less estrogen. If you are using this medication to treat symptoms only in and around the vagina, it's best to consider products applied directly inside the vagina before using medications taken by mouth, absorbed through the skin, or injected. This medication may also be used by women who are not able to produce enough estrogen, for example, due to hypogonadism or primary ovarian failure. Some estrogen products may also be used by women after menopause to prevent bone loss, but there are other medications that may be more effective and safer, such as raloxifene and bisphosphonates including alendronate. These medications should be considered before starting estrogen treatment. Before using the estradiol patch, make sure to read the patient information leaflet provided by your pharmacist, and ask your doctor or pharmacist if you have any questions. When applying the patch, make sure to peel off the backing and apply it to a clean, dry area of the lower stomach or the top of the buttocks. Press the patch firmly in place for about 10 seconds. Avoid applying the patch to the breast or on oily, broken, or irritated skin, and do not apply it to areas where it might be easily rubbed off. The patch is usually worn for 1 week and then replaced, so make sure to follow the dosing schedule carefully. The dosage of the patch is based on your medical condition and response to treatment. When replacing your patch, apply it to a different area and wait at least 1 week before applying a patch to the same area. Dispose of the old patch in the trash and do not flush it down the toilet. If a patch falls off, reapply it to a different area. If the patch does not stick completely, apply a new patch and wear it for the rest of the 7-day period. Do not wear 2 patches at the same time. Remember to use this medication regularly to get the most benefit from it. To help you remember, change the patch on the same day each week and mark your calendar as a reminder. If your condition does not improve or worsens, be sure to inform your doctor. Some common side effects of using the estradiol patch, transdermal weekly include skin redness or irritation at the application site, abdominal pain, nausea, bloating, breast tenderness, headache, or weight changes. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to note that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience any serious side effects such as persistent nausea or vomiting, mental or mood changes, breast lumps, unusual vaginal bleeding, severe abdominal pain, or swelling in the hands, ankles, or feet. In rare cases, this medication can lead to serious issues such as blood clots, heart attacks, strokes, or pulmonary embolism. Seek immediate medical help if you experience symptoms such as chest pain, sudden/severe headache, weakness on one side of the body, trouble speaking, sudden changes in vision, pain/swelling in the legs, or trouble breathing. While serious allergic reactions to this product are rare, it's important to seek medical help right away if you notice any symptoms such as rash, swelling of the face or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. Estrogens, either used alone or with another hormone, have rarely caused very serious side effects. Discuss the risks and benefits of hormone treatment with your doctor. Estrogens should not be used to prevent heart disease or dementia. Estrogens can increase the risk of cancer of the uterus. Taking a progestin as directed by your doctor can help decrease this risk. Tell your doctor right away if you have any unusual vaginal bleeding. In postmenopausal women, estrogens, taken with or without a progestin, increase the risk of cancer of the breast/ovaries, stroke, dementia, and serious blood clots. When used along with a progestin, estrogens also increase the risk of heart disease. The risk for serious side effects may depend on the dose of estrogen and the length of time it is used. This medication should be used at the lowest effective dose and for the shortest amount of time. Discuss the use of this medication with your doctor and check with him/her regularly to see if you still need to use this medication. If you will be using this medication long-term, you should have regular complete physical exams as directed by your doctor. Before using the estradiol patch, make sure to let your doctor or pharmacist know if you have any allergies or if you are allergic to any of the inactive ingredients in the product. Be sure to discuss your medical history, including any conditions such as cancer, blood clots, heart disease, high blood pressure, diabetes, and more. It's important to avoid smoking or using tobacco while using this medication, as it can increase the risk of serious health issues. If you have surgery or will be immobile for an extended period, talk to your doctor about any special precautions you may need to take. Limit your time in the sun and protect your skin while using this medication, as it may cause dark areas on your face and skin. If you wear contact lenses, be aware that you may experience vision problems while using the estradiol patch. Additionally, inform MRI testing personnel if you are using the patch, as it may contain metals that can cause burns during the test. This medication may also affect children's growth and development, so it's important to discuss any potential effects with a doctor if it is being used by a child. Lastly, the estradiol patch should not be used during pregnancy and may affect the quality and amount of breast milk produced, so be sure to consult with a doctor if you are breastfeeding. It's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with the estradiol patch, Transdermal weekly include aromatase inhibitors, such as anastrozole, exemestane, letrozole, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. It's also important to note that this medication may interfere with certain lab tests, potentially causing false test results. Make sure lab personnel and all your doctors are aware that you use this drug. If this medication patch is chewed or swallowed, it could be harmful. If someone has taken too much of this medication, remove the patch if possible. If serious symptoms such as passing out or trouble breathing occur, call 911. Otherwise, contact a poison control center immediately. U.S. residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. It's important to take this medication as directed by your doctor, typically once a week at the same time each day. Be sure to follow the dosage instructions carefully and apply the patch to clean, dry skin on the lower abdomen or buttocks. Make sure to rotate the application site to avoid irritation. If you have any concerns or questions about using this medication, consult your healthcare provider. It's important not to share this medication with others. While using this medication, it's important to have regular physical exams and medical tests to check for any potential side effects. This includes checking your blood pressure, breast health, and pelvic health. It's important to follow your doctor's instructions for breast exams and report any lumps right away. Make sure to keep all of your medical appointments and talk to your doctor for more details. In addition to using this medication, it's important to take steps to prevent or control high blood pressure, high cholesterol, and diabetes. This can help reduce your risk of heart disease and stroke. Lifestyle changes such as reducing stress, eating a healthy diet, maintaining a healthy weight, staying active, and quitting smoking can all help to improve your overall health. Keeping your mind active with mental exercises can also be beneficial. Talk to your doctor about lifestyle changes that might benefit you. If you're experiencing hot flashes, making lifestyle changes such as quitting smoking, dressing in light layers, avoiding certain foods, reducing stress, and staying active can help to reduce their frequency and severity. To promote healthy bones, it's important to engage in weight-bearing exercise, quit smoking, limit alcohol consumption, and eat a balanced diet that includes enough calcium and vitamin D. Your doctor can provide specific advice on any necessary supplements and lifestyle changes. If you happen to forget to change your patch at the scheduled time, make sure to replace it as soon as you remember. And remember, you should only use one patch at a time. When storing the estradiol patch, Transdermal weekly, make sure to keep it at room temperature. Do not remove the patch from the pouch until you are ready to use it. It's important to keep all medications away from children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard the patch when it is expired or no longer needed, following the instructions in the How to Use section. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.